Good afternoon, everybody, and thanks for tuning in. John Kelly, psychotherapist and addiction specialist today. How are you? Thanks for tuning in. I hope you're well. Today, we're going to be talking about low self-esteem. And today's show is going to be called Low Self-Esteem, A Head Full of Turmoil. I've been researching low self-esteem for decades. I wrote a paper on it back in the 80s, early 80s, and I wrote a book on it. It was published in 2002 called Warning Signs, a Guidebook for Parents. And it's all focused on low self-esteem and what it does. What is low self-esteem, you may ask? Really, when you get to the core of it. Low self-esteem is a combination of thoughts and feelings that are coming out of left field. We call them cognitive distortions. And what are cognitive distortions? They really are distorted thoughts. Like I said, these are thoughts that are coming out of left field and they're entering your mind and they're just constantly accumulating, snowballing, if you will. There's a snowball effect to them within your head. And this kind of negative thinking is what we call, destructive thinking or stinking thinking. I mean, this is a situation where it's as if you have an internal critic that's constantly talking to you in your ear. And again, the problem with thoughts, distorted thoughts, is that they cause distorted feelings. Remember, thoughts create feelings. So if you have an internal critic in your head constantly demeaning you, it's going to create insecurity, inadequacy, and inferiority within you. Now, talk about walking around in turmoil and having a head full of turmoil. Can you imagine walking around all day, fending off these distorted thoughts that are creating these negative feelings? I mean, you're not going to be feeling good. You're not going to be feeling as good as others. In fact, you're going to walk around feeling less than others. And I think that's one of the best ways to describe low self-esteem, that you don't feel as good as others based on this accumulation of distorted thoughts. And they are distorted. They're coming out of left field. They have a very destructive nature as well because they're progressive and they constantly snowball. And the destructive effect, it can be found in obsessive destructive disorder. In other words, obsessive compulsive disorder that can be very destructive. And what I mean by that, we can look into drug use, we can look into somebody that's cutting themselves, we can look into gambling, pretty much any type of obsessive compulsive disorder is trying to stave off, fight off this destructive thinking, this negative thinking, this uncomfortable thinking. This kind of thinking just makes you feel so uneasy, so uncomfortable, that you're looking for a way to get out of it. You're looking to focus your attention on something else. Because as long as this internal critic or little bullshitter or whatever you want to call them, as long as they're going on in your head, there's a part of you that wants to turn it off, to soothe it, to have a calmer mind, and not to have such a negative criticizing mind. And that's where the obsessive compulsive disorder comes in many, many cases. Also, it can create a lot of anxiety and can be very lethal in depression. I've never met anybody that is depressed that does not have a low self-esteem. I have never met anybody that is severely depressed, that is not hopeless, feeling worthless. And it's not true. They're not hopeless and they're not worthless, but this combination of these cognitive distortions or negative thoughts are telling them they are. And it becomes very, very uncomfortable. And as I said, it progresses and can lead from severe depression into major depression into suicide. This is what happens. I've never met anybody suffering from severe depression or major depression that had confidence in the future. See, low self-esteem robs your confidence. And the way to beat low self-esteem is to go right at it, talk back to this internal critic, to move forward, not to wait to get motivated to take action, but to go into action first, because action actually creates motivation. And as long as you're motivated and moving, and you're taking action, and that action is creating more motivation, lots of times you're going to dismiss these negative thoughts, dismiss these negative feelings, and you're going to quiet yourself and bring yourself down. Now, something else I have to tell you is that there's a checklist out there, and we're going to put it up on the screen for you, of cognitive distortions. I believe there's 10. And when you look at this list, I want you to memorize it or even copy it. Copy it first, memorize it later, but keep it where it's an eye shot. Because whenever you're feeling in a blue mood and you're really down on yourself and you're really into self-criticizing and demeaning yourself, and that little bullshitter in your head is telling you you shoulda, woulda, coulda kind of stuff, you can look at this list and you will automatically see and identify what distortion is taking place in your head. Are you jumping to conclusions? Are you fortune telling what somebody else is thinking? Are you involved in just black or white thinking, which doesn't really truly exist? It's either one way or the other. Come on, how about all that gray area in between, right? There's a lot of gray in life. It's not just black or white. So this checklist of distortions can reveal a lot to you. It's by Dr. David Burns. He's wrote a couple of great books, and I've read them. His first major book was Feeling Good. Fantastic book. Fantastic book. And if you're suffering from depression or if you're suffering from low self-esteem, you really need to read this book, because low self-esteem is progressive. It's a progressive illness. If you don't deal with it, it only snowballs and gets worse and progresses. And it will progress into depression. And in depression, my personal outlook on depression is like a cancer to mind, because it is very progressive. And once you have depression, it's not a friend. It's not there to make you feel good. It's going to try and progress to the point of suicide if you let it. So it's very important, and it's nothing to be ashamed of. At any one time, any 10% of the population, at least 10% of the population, is suffering from depression. So low self-esteem is something we have to look at. We're going to be talking a lot more about it. We've got some great experts coming on in the next couple of weeks, and I think you're really going to enjoy what we have to offer, and I think you're going to learn a lot. Thank you so much for tuning in today. We really appreciate it. Please subscribe. We can't thank you enough. We're always open to your comments and any info you want to send us. God bless. Stay safe. Make it a great day. Thank you.